Welcome to Cordia Podcast, where we try to bring research to common knowledge. My name is Khushboo, founder and CEO of vCare Denmark and Cordia Healthcare Private Limited. I have Dr. Banshi Saboo with me today, who is one of the leading diabetologists in India and is well-renowned globally for his practice and research. He is also chair-elect for International Diabetes Federation for Southeast Asia region. He has researched on many topics like type 1 diabetes, type 2 diabetes, its subtypes, and obesity, and has published 200 plus papers and articles. Welcome, Dr. Saboo, and thanks so much for joining us in Cordia Podcast today. In this episode, we are curious to know about obesity, yani ki motapa, and type 2 diabetes. Can you first define obesity for the audience and talk about its overall prevalence as well?
First of all, thank you, Khushboo, for inviting me for this wonderful podcast which you are planning. Obesity or motapa, the overall incidence in our country, people think it is not very high, but you will be surprised. The recent publication of ICMR in diabetes study, where I was also the part of it, and it's a national study, and from Gujarat I was the principal investigator. We were having 254 million people who have their BMI of more than 25. So you can understand, out of 120 crore that time population which was expected in India, we were having almost 25 crore plus people are obese in our country. So see, such a paradox which we have, that some people are undernourished, the children are dying because of undernourishment, but at the same time we are also malnourished, in considering that I am talking the person who is obese is also malnourished, because getting obesity, and still they think that it is a healthy condition. The worst part is we have a central obesity, that is keval पेट का भाग बढ़ा हुआ. This central obesity is with 350 plus million people are having central obesity. So उनका BMI normal हो सकता है. अभी ओबेसिटी का मतलब है आपका बॉडी मास इंडेक्स. यदि वो 25 के ऊपर है साउथ एशियंस में, तो हम उनको ओबीस कहते हैं. यदि यूरोपियन के अंदर वो 30 के ऊपर है. सो आप समझिए, हमारा एवरेज लोगों को जो डायबिटीज होने की संभावना है हमारे देश में, वो 23 BMI के बाद ही बढ़ने लग जाता है. तो ओबेसिटी और डायबिटीज का भी बहुत क्लोज लिंकेज है. आई मीन, ए पर्सन हु इज बिकमिंग मोर ओबीस, देयर आर मोर चांसेस ऑफ डेवलपिंग डायबिटीज, and it is increases so much so that sometimes we are seeing even very young adolescent persons who are becoming type 2 diabetes in our country. So you can understand that the disease is increasing very, very fast in our country. Pediatric obesity had become already a big challenge for pediatricians, and the school health program. One side the school health program where we have to feed the children, and the other side the schools, the public schools, private schools, we have to talk to them and teach them about the healthy diet and the nutritious diet which they should have, rather than eating junk food, and which is increasing the obesity. So obesity is a major challenge. Probably what I'm saying is, after 2025, this number will increase further high, because awareness about the obesity in our country is very, very poor. People think it's a healthy condition. It is not considered as a disease. People think only weight reduction, it's only for glamour, not for the purpose of health. So that's the biggest challenge for us.
Yeah. And sir, it is fascinating to see that there is such a scale of obesity. You were also mentioning that there's central obesity. Does it have something to do with inches as well, and not only BMI or not only weight? Does it also, the inches matter as well, right?
Very important question which you asked, because now we are talking about the waist height ratio. So if person waist circumference or abdominal girth, which is more than half of your height, one considered with a central obesity. Abdominal girth is a simplest marker of increasing insulin resistance, which is responsible not only for increasing the risk for diabetes, but also for heart disease, also for the non-alcoholic fatty liver disease. So you can understand that how risky it is to have a central obesity. Now, why it is increasing in our country? One of the important reasons is sedentary lifestyle. And second, people are becoming more obese because they carb eater. People think that only fat we have to restrict. But fat alone restriction is not sufficient. We have to completely change our nutrition, where you have to increase your protein intake and decrease your carbs. The carbohydrate intake has to be reduced significantly. So these two things are very, very important. It requires a lot of advocacy. It requires a lot of government interference also. And some public systems should be that if we increase awareness about it, people should go more for walk, more healthy lifestyle. And that's the only way by which we can improve the, and coming 20 years or 30 years, we can make our people more healthy. Otherwise, I'm sure that we will have more obese and diabetic patients in the world.
Yes. And sir, this is such an important point you made about the carbs in Indian diet primarily. Can you, in common language, explain which carbs are good and which carbs are not so good? And if people are eating, let's say, chapati and potatoes, they should also know that it is only carbs with carbs, because and there is no protein in it. So can you explain that as well, so that people understand that in the importance?
हम जो दाल खाते हैं, that also contains carb. It's not like that is not the carbohydrates. Only it contains 40% protein. If you are taking the fruits, that also have the carbohydrate, but it also have a lot of fibers. So you try to understand the carbs which contains complex carbohydrate, which is already having protein in it and the fibers in it. Not juicy fruit, not direct juices, not simple मैदा या आटा या गेहूं की रोटी बना के जो खा रहे हैं, मक्की और बाजरा, they are all मीठा धान. So try to change from cereals to millets and millets to dal, pulses. That is what we are explaining our patients. We ask them to eat more vegetables. Vegetable also contain carbs, like it will be complex carbohydrate because there is a lot of fiber. Vegetable even not have the fructose also. So that's a very complex carbohydrate. And then we have a carbohydrate even in the fruit. So 5 servings we are asking. 3 servings of vegetables and 2 servings of the fruit also. One fruit, juicy fruit, should be in a very small quantity, but like apple and by the guava or all these fruits can be taken in a more, papaya and all these things. This is very important and education point of view. When we are talking to the patient, that these are some simple rules which they have to follow. In morning time, they should take nuts. Now, nuts contains good fatty acids and fats also. We ask them to take fruit. We ask them to take the sprouts. So that means you are taking fruit, protein, everything you are taking, carbs and everything in the morning, but not like simple aloo paratha, idli dosa, not poya upma. These are the commonest items which we see in our morning breakfast. So that is to be changed. In afternoon time, people think that, taking only 1 katori of vegetable or 2 katori of vegetable and try to take 5 chapati, that is to be reduced completely over. We have to change it. Take a lot of salad. Take only 1 chapati. That can be again multigrain with more millets you can add. And take more vegetable. And you can have also the buttermilk, which is like a probiotic food. In afternoon time, if someone is more hungry, he can again take some small amount of fruit because that will be your second serving. Some people may not take in the afternoon, they may take late evening if they are taking early evening the dinner. Early evening dinner is always better if someone can take it, because in India people are now working till late evening. So still we request them to take early evening dinner, which is around 7 p.m. or less than before that. So this is a healthy diet pattern. People think that 30 minutes walk or 30 minutes walk is sufficient. We say that 10,000-12,000 steps are good enough. But if you can run for some time, it is very good because that will really shed your weight. It is high intensity aerobic exercise with some muscle strengthening exercise, stretching, abs, particularly abdominal exercise that are very important, muscle strengthening, stretching, all those things, and do pranayama, do yoga, which will help you in your stretching, and plus meditation will help you for reducing your stress level too. So this is like a combination of exercise and your diet, which is very, very important. Now this I talked about the healthy lifestyle. It does not mean someone is obese or not, someone is diabetes or not, someone is absolutely fine. He feels that I am okay, but still he should follow all these healthy lifestyle. And throughout the lifetime, one should continue with these healthy lifestyle for not having diabetes, not having heart disease, and not having other complications. So these non-communicable diseases are preventable, but one should see that and be how they are.
Yeah, but I think this is very informative what you just said, and I hope a lot of our audience get the benefit of it, because as you say, prevention is better than cure. So hope by using these tips and tricks and using these advices, they prevent cardiovascular diseases and other non-communicable diseases as well. So thank you so much, Dr. Saboo. Now, which common comorbidities, talking about NCDs, which can be accelerated by obesity? You just mentioned that they can result into many NCDs, but which ones?
So the non-communicable diseases are many, but because obesity itself is one of the important non-communicable diseases, but it's a mother of many more diseases. The diabetes, hypertension, and heart disease, which are commonly the non-alcoholic fatty liver disease. Even the cancer and stroke, the CV stroke, they all come under the part of non-communicable disease. Obese person have higher risk of cancer also. So many of these diseases can be prevented only if we start talking about the prevention of obesity itself. So like diabetes have autoimmune part also. So you cannot prevent that autoimmune part, but at least type 2 can be prevented. Similarly, the blood pressure for everyone may not you can prevent, but still many patients with hypertension, actually they have developed because of one of the reason is they have become obese. Similarly, the non-alcoholic fatty liver disease or the persons with heart disease, 80% or 90% of that can be prevented only by if we take care of the obesity. So I always say once you become obese and then you start following all this, it's better one should not develop obesity itself. That is what we should prevent obesity in the society.
Yeah. Thank you so much. What symptoms an obese person in that case should be very careful or watchful about? How can we prevent from getting serious NCD or a severe NCD for a person early? How can we identify it early in the phases of the life?
One is the obesity one can identify very easily. Because of it does not require anything. And the simplest test, as I told you, the abdominal girth measurement. That is what we do because they are at the higher risk of developing all other non-communicable diseases. But then other healthy lifestyle also come, like suppose somebody is smoker and tobacco chewer, they are more developing heart problems and cancers. Then the people who are already late diagnosed with blood pressure or cholesterol, they develop more of a heart and kidney problem. So early and aggressive control of these problems one may have. So they require regular checkup. Now, regular checkup means they should be screened for these problems because in India we have very high number of people with obesity, diabetes, hypertension, dyslipidemia, and all these problems are very, very high. So that's the reason they should be regularly checked up for. One should not get diagnosed late rather than early diagnosis. Early and aggressive management will help them for not to have all these problems.
And what do you think regular monitoring and use of technology, or you mentioned lifestyle changes already, you talked very good about that already. But monitoring and use of technology, how can that help a person in managing their disease?
The monitoring or the technology uses we do with some person who had already developed like diabetes or the blood pressure. Then they can be put on ambulatory blood pressure monitoring. For the cardiovascular, we put the Holter monitor. We put the patient on a continuous glucose monitoring. All these devices are once somebody have developed because evidence at present we have for that. Because otherwise it will be very costly if you put it for everyone. You can't do it for 140 crore people. So you have to scientifically justify that, yes, it is going to help them. But definitely, everyone will be helped by doing a lifestyle modification. And that is what we can ask everyone to follow it. Whether it is in a school health program, adolescents, going in college, the young ladies, working female or working male, or even those who are not going anywhere and in housewife or house managers, everyone should follow the same healthy lifestyle. That is what my recommendation.
Thanks for a great conversation, Dr. Saboo. These simple recommendations and advice provided by you will certainly help thousands. Keeping check on baseline, weight, regular monitoring of sugar, and healthy lifestyle are key takeaways from this podcast. Thank you for translating your research efforts into practice as well on a daily basis. It is inspiring. Thank you.